आशीष मांगे, गाहे तव जय गाथा। जन गण मंगलदायक जय हे भारत भाग्य विधाता। जय हे जय हे जय हे, जय 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 हे।
I now request Dr. Bhaskar Rao, the Managing Director of KIMS Group of Hospitals, to welcome the gathering.
Good evening, everybody. On behalf of KIMS Group of Hospitals, I have a great pleasure in welcoming the first citizen of our state, Dr. Srimati Tamilisai Soundararajan, Honorable Governor of Telangana, and the very distinguished orator, Ms. Sujata Rao, this evening. I am deeply grateful to Mr. Yash Ranjan, Principal Secretary of Government of Telangana and Chief Advisor to Ushalakshmi Breast Cancer Foundation, for his outstanding and unwavering contribution to the foundation's activities over the past 13 years. When Raghu undertakes to do anything, he does it with 100% commitment and dedication. Having spent 10 years in the United Kingdom, shortly before relocating to India, Raghu met me to present his dream of improving breast health care in India. I must be honest here, I did not take him seriously. However, I was impressed with his bold, time-bound vision that he presented to me. So I gave him an opportunity to unfold his dreams. Today, I am very proud of the fact that he has been working diligently with a laser-sharp focus and rock-solid determination over the past 13 years and delivered much more than he promised me when he met me first time in July 2007. He not only established South Asia's very first comprehensive breast center at KIMS, he also established a not-for-profit foundation that has been championing a number of unique initiatives towards empowering people and creating the much-needed awareness about importance of early detection of breast cancer. To do this in a country where the disease is considered to be a taboo, even in urban India, has been a tremendous achievement. To honor Raghu's dedication and love for his mother and motherland, KIMS has proudly associated his mother's name, Dr. Ushalakshmi, to the breast center at KIMS, and hence the name KIMS Ushalakshmi Center for Breast Diseases. Raghu has achieved at a very young age, within 10 years, what some may take a lifetime achieve. Breast cancer is the commonest cancer affecting women in India due to lack of awareness and absence of an organized population-based breast cancer screening program. More than 60% present in advanced stages. Contrary to the West, where most breast cancers present over the age of 60, breast cancers present at least a decade earlier in India, in younger women in India, between the ages of 40 to 60 years. Since 2007, KIMS has been at the early detection through opportunistic screening. We were the second center in India after Tata Memorial Center in Mumbai, and the very first center in South India to have acquired a full-fledged digital mammography system in 2007, which at that time was widely considered to be a revolutionary advance in detecting early impalpable breast cancers, particularly in younger women. I have known Raghu's parents for over 30 years, and his father, Professor Chalapati Rao, an eminent surgeon, served KIMS selflessly as a director of medical education for 14 years between 2004 and 2018, without taking a single rupee as remuneration. So more power to Raghu's arms and to the multidisciplinary team at KIMS Ushalakshmi Center for Breast Diseases, and indeed to the foundation. Finally, a very warm welcome to all those watching this program, and I am sure that the oration would enlighten the viewership about the importance of early detection, the only way to fight breast cancer. Thank you very much for giving me this opportunity.
Thank you, Dr. Bhaskar Rao garu. Everything, Madam Governor, it is indeed so heartening to see you wearing pink, including the mask as pink, which is a color that represents breast cancer awareness. I'm so really happy and very, very grateful to you, Madam. The orator for this evening, Ms. Sujata Rao garu, the Managing Director of KIMS, Dr. Bhaskar Rao garu, my dear friend Yash, and to everyone watching this program this evening. As they say, everything begins with a story, and my story began when I was working in the UK, training to be a specialist breast surgeon, and my mother was diagnosed with breast cancer. I realized that breast cancer is the commonest cancer affecting women in our country, and due to lack of awareness and absence of an organized screening program, more than 60% present in the advanced stages. I also realized that breast surgery was not a subspecialty. There were very few dedicated breast specialists. There was virtually no concept of the breast center in the country. There was very little awareness about early detection, and counseling at that time was not even part of our medical curriculum. And therefore, my wife Vaijanti and me, despite having lucrative career opportunities in the UK, decided to relocate to India and strategically work towards improving breast health care in this country, along with colleagues, friends, and the government. I set myself 4 goals. The first, to introduce the breast health center concept. The second, to establish a foundation. Third, to implement a population-based screening program. And finally, somewhere along my professional lifetime, to see breast surgery evolve as a distinct subspecialty in the country. The breast center concept, what is it? 9 out of 10 women who present with breast health issues do not have cancer. In fact, they do not feel happy visiting a cancer center for routine screening. They would any day prefer visiting a center which is reassuring, which is not called a cancer center. And in fact, this breast center concept is not a cancer center. It's a breast health center which deals with vast majority of women who are worried well, and in fact treat those who are diagnosed with cancer in a multidisciplinary and a sensitive and caring environment. Over the past 20 years, there is ample evidence to suggest that improved outcomes for breast cancer or breast health concerns can be achieved if specialists with a declared interest and training manage patients in dedicated comprehensive centers. So, mirrored upon the first breast center that was established in California, and based upon my experience of having worked at world renowned centers like the Nottingham Breast Institute and the Royal Marsden Hospital, I conceived and designed South Asia's first freestanding purpose-built center for breast health at KIMS Hospitals in Secunderabad. This is not just a cancer center, as I said, this is a dedicated center which exclusively manages patients not only with cancer but also benign disease, most importantly by an exclusive dedicated team that deal with only management of breast diseases. And we are all aware that no one can whistle a symphony. It takes a whole orchestra to play it. And I must, thank Dr. Bhaskar Rao garu for giving me a free hand and standing rock solid behind this vision. And this vision could not have been accomplished without a team. And this is the team because of which the breast center has made its name. It's not because of me, it is because of the team. And the most important member of the breast center, just like a cardiologist or a physician requires a stethoscope, the most important individual is the radiologist. She is the eyes and ears for a surgeon managing breast diseases. And I'm very grateful to Dr. Srikala, who has really been the sheet anchor for the breast center at KIMS. So the breast center, just like you have the smart mission, smart India, or the smart cities mission, which was launched by the government of India in 2015, The breast center concept is a smart breast center concept which is resourceful, creative, perceptive, astute, inventive, integrating and adapting technology and newly emerging evidence-based practices to ensure best possible care. The second and the final component that I would be addressing is something very dear to my heart, a foundation which is established in my mother's name. We know that breast cancer is a closet issue. It is an issue which is hushed up, and that is why more than 60% present in the advanced stage. And I knew that I had to disrupt this attitude. And therefore, this foundation was established to create awareness, to reach out to the community and support breast cancer survivors. There are three phases in the foundation so far. The first 5 years was spent in priming the community. The second 5 years was spent in implementing a population-based screening program. And we are now in the third phase of 5 years where we are reaching out outreach initiatives through innovative programs. This is my brother, I would call Yash, who has been shoulder to shoulder standing with me throughout since the time and even before the time I came back to India, guiding me, advising me, holding my hand. And without him, this foundation would not have formed, could not have seen, could not have done anything whatsoever over the last 13 years. So in the first 5 years, we empowered the community through information booklets about simple, easy to understand language, which has been explained in English and in Telugu. And for the first time ever, Breast Cancer Care UK, which is UK's largest breast cancer charity, partnered with an overseas foundation. We launched the Pink Ribbon campaign, and we got celebrity breast cancer survivors to speak and explain why they had breast cancer and to give the much needed confidence to people. There are several people here who are being showcased. This is Pamela Yash Chopra, who is the wife of the legendary Yash Chopra, whose birthday was celebrated yesterday. Of course, he passed away several years ago. She is one of our patrons. The Pink Ribbon Walk, which we launched with just 50 people attending in October, which represents Breast Cancer Awareness Month. This is a lady, a patient of mine, who had chemotherapy before surgery. On day one, with the drain bag, she came and flagged off the walk. What started off with just 50 people, today we have thousands of people who join. And unfortunately, because of the pandemic, for the very first time in 10 years, we are not conducting the Pink Ribbon Walk. We have people from all sections of the society. This is a lady, a patient of mine, a 23-year-old lady from the old city, who again flagged off the walk on the day one after having surgery. We started off this walk in Hyderabad. We extended this walk to Warangal. We extended this to Vijayawada, where we had 10,000 people participating in the walk. We have had several people who have launched these walks as well. And you have seen recently the buildings have turned pink in Hyderabad. This is the Buckingham Palace. This is the Tower of London. This is the White House turning pink. And Hyderabad is the only city in Asia where so many monuments, so many buildings turn pink on one night to represent the power of pink, to create awareness about the early detection of breast cancer. Legislative Assembly building is the only building in the whole country which has turned pink in support of breast cancer awareness. And advocacy over the past 10 years has indeed made an impact in urban India. But what about rural India? What applies to urban India does not apply to rural India, because 70% of our population live in rural India. And therefore, in an effort to create awareness and implement a screening program, we have devised a way, because screening mammography does not work because of the huge costs associated with it, huge variation in mammographic reporting, because we have very few breast radiologists, and most importantly, 87% of our population is under the age of 50, where screening may not work. So, to find an Indian solution to Indian problems, we have identified healthcare workers and taught them to perform clinical breast examination, and we partnered with the governments of Telangana and Andhra Pradesh. This is the first pilot project initiated in 2012 with the Chief Secretary, then Ms. Minnie Matthews, the District Collector, and everyone concerned with the department, and then subsequently with the government of Telangana, where we had the Honorable Chief Minister, who stood shoulder to shoulder with the foundation in implementing South Asia's largest population-based breast cancer screening program, where we created awareness and also through booklets printed in Telugu. And we implemented the screening program through these healthcare workers employed with the government. And over a period of 4 years between 2012 to 2016, over 200,000 underprivileged women be in 4,000 villages were screened for early signs of breast cancers, and those who were diagnosed were treated free of cost through the Arogyasri scheme. This is a typical village center where the healthcare worker empowers the people and then the women, and then they examine these women. I also had access to the Secretariat's GAD where I was clarifying the doubts for the healthcare workers. The screening program in the Telugu States in 2016 made a national impact. I was invited to be a member of the technical advisory group set up by the Ministry of Health, and the recommendation to implement population-based screening program across the nation was approved. And today I'm pleased to say that the national screening program being done through the National Health Mission alongside the oral and cervical comprise of breast cancer screening through clinical breast examination. And then we are in the final 5-year phase, the third phase, which I mentioned. Inspired by our Honorable Prime Minister's Digital India campaign, I conceived and designed the world's first mobile app on breast health, which has every conceivable information about breast health, benign breast diseases, and breast cancer explained in simple, easy to understand languages in 12 languages. And this initiative, which is called ABCs of Breast Health, is a foundation's initiative which can be downloaded free of cost both in App Store and Google Store. And thousands of people have downloaded this app so far, which has been launched by none other than one of India's icons, Amitabh Bachchan, in 2017. And finally, in conclusion, Madam Governor, I would like to emphasize that the rising incidence and mortality and advanced stage at presentation is a cause for great concern. Breast cancer advocacy over the past decade has disrupted the taboo and created the much needed awareness about early detection in the Telugu States. And from 2019 onwards, we are reaching out to the community and implementing early detection initiatives through a number of innovative programs, which hopefully will save scores of lives. When I graduated 29 years ago, I've come a long way. My mother, Dr. Ushalakshmi's setback in the form of breast cancer was the driving force for me, and with focus, determination, and hard work, alongside colleagues, friends, and the government, I've been able to make a meaningful difference. And returning to my motherland, to my parents, to look after my parents, alongside do things and initiatives for the country has been a godsend and the biggest and the greatest opportunity in my life. Namaskaram. So with these words, I would like to now Yes. So nothing gives me more pleasure than to introduce Miss Sujata Rao Garu, who was the former Union Health Secretary. She is very well known across the country, a 1974 batch IAS officer who has been from the United AP cadre, has served as the Union Health Secretary and has served in a number of positions and spent out of 36 years of her service, 20 years in the health sector. She was the chairperson of the Portfolio Committee of Global Fund for HIV, AIDS, TB, and Malaria between 2007 to 2009, member of the Global Advisory Panel of the Bill and Melinda Gates Foundation, founding member of the Public Health Foundation of India, member of the advisory board of the Ministerial Leadership Program at the Harvard School of Public Health, and member of the high-level panel on Global Risk Framework and National Academy of Sciences in the United States, and trustee of the Population Council in USA, and member of the boards of several NGOs. An MA from Delhi University, an MPA from the Harvard University, and in 1991, she was a Takemi Fellow at the Harvard School of Public Health. She was a Takemi Fellow of the Harvard School of Public Health between 2001 and 2002, and Gro Harlem Brantford Senior Leadership Fellow at the Harvard School of Public Health in 2012. She is the author of the book entitled Do We Care? India's Health Spectrum, published by the Oxford University Press. Madam, it is such a great honor for the foundation that we have your august presence in delivering the oration titled Breast Cancer Advocacy, Screening and Early Detection. Over to you, madam. You are muted, madam.
Thank you. Honorable Srimati Soundarajan, Governor of Telangana, Dr. Ushalakshmi garu, Dr. Krishna Rao garu, Yash Ranjan, Dr. Raghuram garu, and distinguished guests who are watching this program. I'm indeed thankful to Dr. Raghuram for having invited me to deliver the Ushalakshmi Breast Cancer Foundation oration, specifically touching upon the importance of breast cancer advocacy, screening, and early detection. I would like to compliment him on his efforts, which have absolutely outstanding for spreading awareness and providing access to information and diagnosis of breast cancer. I would also like to take this opportunity to express my admiration to his mother, Srimati Ushalakshmi garu, for her inspirational leadership in fighting against breast cancer, not allowing it to undermine her, discourage her. Instead, with her positive attitude, she gathered the strength to start a movement to spread awareness about breast cancer, empowering women to value themselves and take preventive action. She exhorted women, saying, it is important for a woman to ensure she gets a mammogram and pap smear every year. After all, it doesn't cost more than a sari. The establishment of the Ushalakshmi Breast Cancer Foundation in 2007 was therefore the logical culmination of her efforts. It is heartening to note that during the 5-year period 12 to 16, the clinical breast examination initiative of the foundation, as has just been detailed by Dr. Raghuram, screened over 2 lakh women in the age group of 35 to 65 years from 4,000 villages in Telangana district, training over 3,750 frontline workers in the process. This is an unusual story of how a traumatic event that affected a mother and son soon translated into social movement, benefiting hundreds of women gain vital information and services against a fatal disease. It's a story of determination where the positive bent of mind not only helped overcome personal grief and fears, but also triggered a new stream of energy to help others in displaying exemplary courage to overcome adverse situations. Ushalakshmi garu reiterated the generally held belief in coping with cancers, not to fear, and believe in the power of individual will to defeat disease. This is an important message. My sister too succumbed to cervix cancer, was told by her doctors, do not fear, stay strong. She tried and stayed positive. That helped her for a while and provided hope to us. It is a message that needs to be disseminated through such events where we gather to pay tribute to the courageous cancer survivors, but also in openly talking about it help reduce misconceptions. The only way one can reduce fear is through raising awareness and knowledge. A few decades ago, TB was tantamount to a death sentence. Over the years, drug discoveries have normalized TB and given us much greater confidence to be able to overcome something so fatal as TB. Fear and stigma have drastically reduced. Now TB has got replaced by the emergence of cancer, or the big C as it is referred to. Even today, great fear and apprehensions are associated with cancer, though things are radically improving. While we see an increasing number of persons affected by cancers, we also see more survival. What is, however, worrying is the majority of women unwilling to get tested or acknowledge the problem and unnecessarily dying. Women are the pillars of the family. Their loss means collapse of the family. This is what makes it a matter of high priority for public policy to step in. The highest cause of death in India is cancer. It is estimated that 1 in every 15 persons will die of cancer. But globally, there were an estimated 18 million cancer cases and 9.5 million deaths in 2018, India accounted for 1.16 million cases and 784,800 deaths. Of them were 1.62 lakhs or 14% of the total cancer cases and 87,000 deaths due to breast cancer. Among women, breast cancer is the leading cause, accounting for almost 40%, surpassing cervical cancer, making the leading type of cancer among women out of all the other types of cancers that we suffer. But the worrying part is that nearly 70% of these women either come too late, resulting in high mortality, or tend to avoid coming at all. In 1972, India started a national cancer control program that was coordinated by the ICMR, maintaining a registry. India has an excellent cohort of data as a consequence of that effort that shows the development of cancer incidence in India under different categories all over the country. Data is collected regularly from 36 population and 236 hospital-based cancer registries. I can think of barely any disease in India that has such a rich amount of data on which we can plan with great accuracy. Cancer is an expensive disease to treat. Studies show that families with a cancer patient spend almost more than half their family income on treatment. Since it is one of the factors for the growing impoverishment of households, government brought it under the health insurance programs for reimbursement. Ayushman Bharat has now provided a higher threshold of reimbursement of rupees 5 lakhs. And these programs certainly help many poor people access treatment. But for a country that has a huge disease burden, a treat cancer strategy is unaffordable. What is needed today is a vigorous and a comprehensive policy for preventing and early screening of cancers. On this foundation of early diagnosis, must establish a continuum of care covering all the critical elements: prevention, early detection, and screening, treatment, and palliative care. A majority of cancers are preventable. Over the years, cancer has transitioned to a lifestyle disease. There are opportunities to avert and reduce incidence by adoption of appropriate lifestyle modifications, such as non-tobacco consumption, that alone is responsible for 30% of cancer. For breast cancer, genetic factors apart, much of the causal factors are obesity, fatty diets, lack of exercise, sedentary lifestyles, and so on. The question is how to bring such behavior changes and prevent cancer on a nationwide basis. In the evolution of cancer policy, there has been a radical shift in strategy since 2010. In 2010, government introduced a comprehensive national program for the control of cancer, diabetes, cardiovascular, and stroke policy, under which the focus shifted from a hospital treatment-centered strategy to preventing and early screening at the primary healthcare level. The 2010 policy sought to integrate non-communicable disease control programs into primary health care. Frontline workers were trained at identifying middle-aged women and taught how to palpitate breasts to identify any lumps and further referral. In 2018, government launched the Health and Wellness Centers. The aim of Health and Wellness Centers was to strengthen the 1.5 lakh sub-centers that had been established at every 5,000 population, with capacity to provide 12 guaranteed services free of cost to any citizen coming to the center, and these services range from reproductive health and child health care to mental health. As of now, these sub-centers established for, as I said, every 5,000 population have 2 auxiliary nurse midwives to provide maternal and child health care services and communicable disease control programs. In the health and wellness centers, though, the non-communicable diseases, namely cancers and vascular diseases, form a key element. The justification for government to focus upon cancer prevention at primary healthcare level was due to the realization that lifestyle modification and behavior change need community engagement. Be it an infectious disease like COVID or a non-communicable disease like breast cancer, involvement of the community is key. In the case of breast cancer, women need to be counseled on the importance of diet modifications and exercise. They need to be made aware of what breast cancer is about, how to detect if something has gone wrong, on what normal and abnormal field looks like, what changes to look out for, so that they seek professional help when such changes are felt, and so on. These messages seem so simple and obvious. As simple and obvious as wearing a mask or using a condom to avoid COVID or HIV infections, yet so difficult to achieve as we see today. In centering breast cancer awareness and early screening in primary care systems, there are great opportunities. Under the National Rural Health Mission and the National Health Mission, as it is now called, over 10 lakh community health workers called ASHAs have been established. These women belong to the community and form a formidable link between the women and the health system, the sub-centers, the primary healthcare centers, the district hospitals, and so on. Another important and game-changing development is that the health and wellness clinics are going to be manned. Those who are established have already got leadership under a trained BSc nurse, assisted with 2 ANMs and 5 ASHAs. There's a huge scope to ensure that the 70% of the women with breast cancer get timely help. With intense training, this team of women can literally identify every potential breast cancer case and refer for confirmatory screening. But then, this is where the policy is weak. While spreading awareness and early screening is possible, it is a follow-up that is weak. Ideally, district hospitals should be strengthened enough with diagnostic laboratories for carrying out the battery of tests required for confirming the preliminary diagnosis. I'm told, as just now, as Dr. Raghuram has told us, that his data shows that 90% of the suspected women do not have breast cancer, and it is only 10% that require clinical interventions. If such facilities were easily available and accessible, it would greatly reduce not just the associated levels of anxiety, but huge costs. We need to remember that half the reason why women tend to hide their problems is the fear of the economic impact it may have on the family resources. This is not an exceptional issue. My cousin, who died of breast cancer at a young age, hid her ailment from her family only because she knew that it would end up diverting resources from educating her children and so on. So it is critical that government invest on making a graded screening process freely accessible to public and private partnerships so that women feel incentivized to come forward for having the screening done at the early onset of the disease when chances of survival are very high. Such a policy would also require incentivizing our Indian manufacturers to come up with low-cost mammography, thermography, or other imaging techniques that can pick up cancers not noticeable through manual means. If they are portable, that would enable using medical vans to go into slums and rural villages, expanding access. The present cost, including all the screening equipment, I'm told, is about 1 to 1.5 crores, excluding the recurring costs. But as technology advances and innovation develops, mobile diagnostic labs will gain ground as the cost of transport and maintenance of the vans can become affordable by combining with other diseases, diagnosis for cervix cancer, for eye care, vascular diseases, and so on. The diagnostic revolution implemented on scale will undoubtedly make it possible for the universal access to information, early screening, and diagnosis in an affordable manner, something that seems out of reach today for most. Realizing this aspiration is, however, full of challenges. It is neither money nor lack of technologies, but the human resources that is the main barrier. Shortage of human workforce is a serious impediment that requires a focused policy. We have wasted too much time in allowing crony medical education to thrive. The corrupt Medical Council of India, after a 2-decade battle, has finally closed down and a National Medical Commission established. It is hoped that more comprehensive policies on creating the appropriate level of workforce are formulated. We have barely 1,250 oncologists in our country. The US has 10 times more with 1/3 of the population. In addition to oncologists, radiographers, pathologists, and the massive retraining of primary care physicians, frontline workers, and nurses in both communication and early screening skills, palliative care and psychological support for the survivors are all needed. Primary care physicians and the team of nurses need to be trained in certain aspects of cancer care, such as basic pain management, palliative care, basic post-radiation and post-chemotherapy care, tobacco cessation activities with capacity to provide patient and family counseling and support. There is a huge dearth of training institutes providing quality training. Provisioning of such training is not impossible anymore. Telemedicine provides huge scope. All that is required is imagination and applying knowledge to achieve specific goals. The credibility of preventive action is, however, dependent on the quality of service delivery in hospitals. Nothing can be worse for the program than having a dissatisfied patient with a botched up treatment. The quality of treatment and service delivery varies hugely in our country, between public and private, between geography, south versus north, between surgeons. District hospitals, the treatment is non-existent and extremely rudimentary. But then, no effective breast cancer or disease control program can be run from Delhi or a tertiary hospital. The district hospitals are a huge resource that need to be developed for diagnostic tests, administration of routine chemotherapy, and conducting follow-ups. Training of MDs with general medicine degrees in basic cancer management, counseling, and preventive oncology needs to be done. The way forward is full of exciting possibilities and potential. What India needs is generation of models in continuum of care. Models that demonstrate the efficacy of community screening in a scalable form, linked up with district hospitals that are telelinked with a tertiary care center where treatment is provided. If the model is not comprehensive, then preventive action loses steam. We have seen that happen in government where we left the screen to find a way for confirmatory diagnosis and treatment. In this process, we lost a lot of patients who could not navigate the complex health delivery system. So can the Ushalakshmi Breast Center Cancer Foundation adopt a district and implement over the next 5 years such a comprehensive model that links your hospital with the intermediate and the primary facilities at the community level? Can it establish the referral pathways and ensure continuum of care up and down the chain? That would be a worthwhile goal to aspire for, and will have several valuable lessons for India. Once again, I thank you for inviting me. I wish the foundation all success in its endeavors and look forward to it achieving more milestones. Thank you very much.
Thank you very much, madam, for that elaborative and extensive, talk. And I would like to have the text of your presentation so that, we can see how best we can implement some of the suggestions that you have outlined. And I would like to come and discuss with you. So the next and the most important component of this evening is by the chief guest address. But before that, I would like to request Mr. Yash, who is the Principal Secretary for the Government of Telangana, the Chief Advisor for the Ushalakshmi Breast Cancer Foundation, to introduce Madam Governor.
Thank you very much. Good evening, ladies and gentlemen. It's a matter of great honor and privilege to introduce the chief guest for today's event, Her Excellency, the Governor of Telangana, Dr. Tamilisai Soundararajan. Her Excellency, the Governor is a qualified medical professional with specialization in gynecology. She has studied in the best known medical colleges in Tamil Nadu, including the illustrious Madras Medical College. She has also taken trainings overseas, including in institutions in Canada, in Australia, and in London. She has received special training in sonology and fetal therapy. And after completing her education both in India and overseas, she returned back to join the prestigious Sri Ramchandra Medical College in Chennai, where she worked as a doctor for several years and participated in a number of programs including rural outreach programs. As a part of her work, she came across the fact that the human needs, the human requirements are much more complicated, and she felt that she will be able to contribute much more by becoming a full-time public figure. And thereafter, she has joined, she has embarked upon a career in public service for almost a decade and a half. She has served the needy people in Tamil Nadu, mostly related to public health issues, but she also has a very sharp focus on women empowerment issues. After working for many years in Tamil Nadu, her services, her contribution to the state and the people were recognized. And approximately a year earlier, Madam was appointed as the governor to the state of Telangana, the second governor of the state, and obviously the first lady governor, the first woman governor to take this position. Since the last 1 year, Madam has initiated a number of fabulous, excellent initiatives. In fact, people credit her to convert Raj Bhavan into a people's institution, into a people's office. She has also seen the worst time of our country during this pandemic. But the fact that she's a doctor, she has such accessibility to people, has given her lots of insights in how the state should manage this pandemic, and her advice, her guidance has been of tremendous value. And today, when you compare the disease management of COVID in Telangana with other states, and you see that we are doing quite better, a large part of that contribution goes to Her Excellency. Madam is also the chancellor of all the state universities, and as that, in that responsibility also, Madam has introduced lots of initiatives. One of the flagship initiatives being Alumni Connect with the Chancellor. Madam wants all the illustrious alumni of the state universities to now start giving back based on their capabilities. And this initiative has also shown very, very encouraging initial results. Madam is also very positive and progressive about technology. Some of you may have read about it, that a few days ago, Raj Bhavan has been transformed into a paperless and a contactless office using lots of digital technologies. We are very grateful that Madam has chosen to be the chief guest for today's evening function. As my friend Dr. Raghuram mentioned, typically during the first week of October, we celebrate on behalf of the foundation the Breast Cancer Awareness Month by conducting a variety of programs. Due to the current situation, we are encouraged to utilize virtual means, and I'm glad that so many people are participating virtually to listen to this brilliant oration by Dr. Sujata Rao and to listen to the guiding words of our chief guest. So without further ado, I would request Her Excellency to deliver her address on this occasion. Thank you very much.
Madam, you're
not audible? Very special good evening to each and everyone who got connected with this webinar. First of all, I appreciate KIMS Hospital and the Ushalakshmi Breast Cancer Foundation for initiating such an awareness program. And first of all, I appreciate you for lighting the heritage buildings in the state of Telangana, particularly Hyderabad, as pink light houses, so that it creates awareness about the breast cancer. And my respects to Dr. Bhaskar Rao, the Managing Director, KIMS Hospital Group, and he is the founder of KIMS Hospital, which is one of the largest corporate hospitals groups of South India. And I appreciate, because recently also I appreciated them for a major lung transplant, took part in their prestigious institution. And really I appreciate their efforts in the advanced medical treatment as well as creating awareness about such situations like breast cancer. And I appreciate the efforts of Dr. Raghuram. As everyone told here, changing it's a blessing in disguise. When he found his mother was diagnosed with breast cancer, breast cancer conqueror, and he took that opportunity to bring awareness among the others and to follow modern techniques in the treatment. And I really appreciate, and he is also the uh, because he is the founder of the and the president of this Ushalakshmi Cancer Awareness Foundation. And with this, for the past 10 years, he is doing excellent job. And as he told, he is unable to organize a pink walk during this year because of the pandemic. But I appreciate you were unable to organize a pink walk, but you have organized a pink talk online. So really I appreciate, and with the guest lecture of Madam Sujata Rao, because as Ranjan told here, we some of the strategies which we wanted to follow and some of the feedback we got from her really helped us to highlight some of the situations of the COVID and a rich experience. Today also, when we were hearing her guest lecture, the outlook she has about the health sector and her service in the health sector for more than 30 years, really helping Hyderabad, and particularly the points she highlighted here. Almost she has covered everything about the breast cancer, whether it is awareness, whether it is treatment, whether it's the social setup, or whether it's the future plan to be followed. Everything she has covered. Almost, I think, nothing to be told. Whether what is the recent trend, whether it because usually we used to see the breast cancer after 60 years. Now all the speakers, including Madam, told now India is actually experiencing young cancer patients, and the treatment modalities are different, and the social awareness is different. And she highlighted what all the government as well as institutions like Ushalakshmi Breast Cancer Foundation should follow. And definitely, as Dr. Raghuram told, her words, and if we follow her words and if we follow her suggestions, really it will be a great help in the prevention aspect of the breast cancer treatment. And I always appreciate Mr. J.S. Ranjan IAS. Yes, Ranjan IAS is a Principal Secretary of the IT and Industries, Government of Telangana. He is an IAS officer of 1992 batch, and besides his official responsibilities, J.S. Ranjan is involved in supporting many social and charitable causes. I myself have interacted with him through webinar with several social service organizations, and I am very happy he has been a part of Ushalakshmi Breast Cancer Foundation right from its inception. I am very happy, and I should say, after above all, I should appreciate Dr. Ushalakshmi. Actually, she is a cause of this foundation, and an 87-year-old breast cancer conqueror and the founder of Ushalakshmi Breast Cancer Foundation, along with her son. Really appreciate Dr. Raghuraman. The foundation and the breast cancer center established in her name have paved the way towards significantly improving the delivery of breast health care in the country. She was an eminent and much sought after gynecologist in Hyderabad and served for a number of years as professor and head of Department of Obstetrics and Gynecology at Nilofer Hospital. I appreciate her not only as founder of the Ushalakshmi Cancer Institute and as a senior gynecologist, like guiding some junior gynecologists like us and developing the students in gynecology. I really appreciate her efforts, and as everyone told here, a very disheartening incident happened in her life has paved the way to form such a foundation which is helping the Hyderabad and the Telangana and the country now. So I appreciate all of you, and really I'm pleased to participate in this program. And as everyone have highlighted all the problems of the breast cancer, but as a gynecologist, as a common person who moved with the women population, again I am telling the awareness and awareness is the answer for detection of the breast cancer. I always narrate one incident which happened during my higher education. at Ramachandra Medical College when I was a student of gynecology. And I also say, as Dr. Raghuraman mentioned, when a patient diagnosed with a lump, 90% it is not going to be a breast cancer. Even 95% is not going to be a breast cancer. But fearing it being a breast cancer, most of the patients fail to report to the correct department. So it should not be a breast cancer department, it should be a breast clinic. So based on that, during my higher education days itself, we postgraduates form a breast clinic, not breast cancer clinic, it's a breast clinic, so that the ladies of younger or elder or old age ladies are motivated to come and examine the breast and to actually, if at all anything is there, so that early diagnosis can be made, so that treatment can be started at early. So before 20 years itself, we almost 15 years itself, we started a breast clinic during our student days, knowing the mindset of the women of this country. And another incident I always say, because why the women are is reporting in a much later date, they are not aware of it. They are not aware of the danger of this situation, this cancer. Once when we were the students of the higher education, that's when I was a student of postgraduate REGU, there was a very big mela, women mela conducted at Chennai. So we wanted we approached our head of department, madam, and told, madam, there is a very big women mela to be conducted at Chennai, and more than 2 lakh to 3 lakh people turnover, women turnover every day. So there is sari shops, jewelry shops, everything. So we want to create awareness about cancer, particularly breast cancer, cervical cancer, uterine cancer. Until till 2008, cervical cancer was the occupying the topmost position. When we were students, actually the most common cancer was cervical cancer. Then after 2008, almost the breast cancer took that place. So we thought with pap smear and breast examination and with mobile mammography, everything, we wanted to set up a screening unit in that exhibition, that mela, women mela, so that women who come to that mela will be screened for the cancers. So we wanted to install a shop there. Then we got a stall there. We all collected, postgraduates collected money. We hired a stall and we had all charts about the cervical cancer, breast cancer, how to diagnose it much earlier stage, and we had pap smear screening, and we had mobile mammography screening and mobile X-ray unit, and all surgery PGs, the gynecology PGs. We were all sitting. A huge turnover of women was there in the mela. The women first week, 1 week experience, I am telling, the women used to come. They used to see our stall was in between a sari shop and a jewelry shop. The women will come, first they will take sari, they will put on the shoulder, they will see the mirror and everything, then we all become ready. Okay, next they will come to us, we have to explain everything. So you be ready with the pap smear, we'll ready with the chart, and ready with the mammogram. So a lot of women are standing in the sari shop. Definitely they will be coming to the next to us. Yeah, we all will be ready. These ladies, no one will enter this stall. Very fastly they will cross us and they will enter the jewelry shop. So then we were just watching it. Then we got angry. Then next week we pulled the ladies, telling that you can wear sari. You can, as madam told here, one mammography and one pap smear testing maybe a cost of a sari. But whether the women are willing to do that, that's a mindset. And then we used to pull them out and then tell, if you are screening your body and if your health screening is there only, if you are in preventive measures only, you can wear the sari and wear the jewels and be happy. You won't believe, after that screening, we found out 10% of the population was suffering from either whether pre-cancerous situation or early cancer situation, and we found 10% of them suffering from any one of the early cancer pattern or pre-cancerous situation. So even in that population, we could find out because of the screening. But initially, it was very difficult to convince the women for screening, because unless otherwise they have any symptoms or unless otherwise they have any pain or anything, they are not willing to screen themselves. So again, even though we are decades, we are talking about awareness and early detection, even still we are in the starting point to highlight the women about the early detection and awareness of the cancer. And I appreciate Dr. Raghuraman because I was thinking, usually the more concentration will be on the high affluent women and the city women and the women who are on the urban population, and always the care about the village women and the tribal women take always the back seat. And really appreciate the screening process. As our Honorable Prime Minister also endorsed, the screening process will definitely diagnose the cancer at much earlier stage. And I also appreciate the Ayushman Bharat because till 2019 December, 4.7 lakh patients had treatment under Ayushman Bharat. Approximately, because in previous health schemes, most of the health schemes, the cancer was not included under that. Madam Sujata also mentioned that. And I should say in the Ayushman Bharat, including, because initially it was not there, but when the incidence of cancer and the need of the cancer was highlighted to the government, our Honorable Prime Minister, and it was added, and more than 3.5 lakh patients, 4.5 lakh patients has been taken care of the cancer patients, and still even now some of the diagnostic procedures are not included, and there is a constant request so that we will take efforts to include all the procedures in the Ayushman Bharat. So I also appreciate, because of the Ayushman Bharat, some of the tertiary care could be given to the cancer patients suffering from cancer. And as it is said, the awareness program and whatever maybe the prevention means, we needn't say to the youngsters and other people whether you find a lump or a bump like that. You have to say the holistic life. That awareness should be first to be highlighted. Whether it is, I always used to say breast cancer means 3H. This is happiness and your hormone status of that to be then holistic life should be practiced. So the spiritual aspect, the physical aspect, and the psychological aspect should be there, and our food pattern, and particularly the obesity awareness about the interlinkage of obesity with the correlation of obesity with the breast cancer, and the hormonal aspects and the breast cancer. And these are some of the even educated people are not aware of it. So a good happy life and a good meditation and a good natural food material which have omega-3 and other cancer material, the anti-cancerous nature can be taken. So all these along with the awareness program, this holistic approach also should be propagated, and this is my request. And apart from the treatment, everything actually here highlighted, there nothing to highlight more. And as it is said here, another thing, I have another request, because I appreciate Dr. Raghuraman for initiating an app, ABC cancer app, breast cancer app. So I appeal, it should be propagated more among the college students. It should be downloaded by maximum college students, even the higher education students. And I think as chairman of the universities, I feel I will take up with particularly the women colleges. This app should be downloaded, so it will be very helpful them. So it is not easy to organize an app. So the app, the maximum should be used by the girl students, women students. So I think that initiative should be taken, and I will ask my secretary to communicate you so that how it can be popularized among the women students. What are the initiatives, smallest initiative as chancellor I could do? I think that this app should be propagated among the women students so that it can be downloaded by the women students. And I should say even the village level people, how the awareness is created. And I appreciate the pinkness of the lighting of the heritage buildings, and then I thought I saw the news item day before yesterday that it is you have highlighted with lights with pink. And as it is said today, I wanted to get my costume also in pink. And I want to inform that Raj Bhavan also will be illuminated pink in the conclusion of this month, so that we have initiated that. So we will conclude this awareness month with pink lights highlighting the Raj Bhavan, so that it will add some awareness among the common public. And as you said, but for the pandemic, we could have had very good programs. But my appeal is, because of the pandemic, some of the early diagnostic awareness programs are ignored, I have to say. Almost it is it has gained less important because of the COVID. So now we have COVID, we have crossed with COVID for more than 5 months, we have lived with COVID. So now we cannot ignore the other medical procedures and the other medical emergencies. So high time we have to think about that also. So let COVID be with us, and it will go away. As it is said, Telangana, I am very happy that Telangana, it is in the decline mode, and we will let us all expect that we will be free from COVID. At least there should be a COVID, the downfall of the COVID and the lowering of the COVID peak here. And really, I appeal that apart from the COVID, concentration on COVID, the awareness about the cancer and the awareness about the other disease like tuberculosis, everything should be initiated as early as possible. And I appreciate the Ushalakshmi Breast Cancer Foundation for taking this noble cause of creating awareness among the people about the breast cancer. And I salute your service. Thank you so much.
Thank you very much, Madam, for your inspiring, encouraging, and insightful talk. I think there are very few people at your stature who can speak so confidently and so meaningfully. And you have really made the Foundation's Day very special by announcing that Raj Bhavan will also turn pink in the month of October as a conclusion. And this will probably be the first time that any Raj Bhavan in the country, just like the Legislative Assembly in Telangana turned pink, the Raj Bhavan also will be the first Raj Bhavan in the country to turn pink. On behalf of the Foundation, we are immensely grateful to you for this very, very noble gesture, Madam. Thank you very much, Madam, for this very, very kind offer and for sparing your valuable time. So I now like to request my mother, who has been the force behind the campaign over the past 13 years, to deliver the vote of thanks.
On behalf of the Foundation, my heartfelt gratitude to Dr. Tamilisai Soundararajan, Honorable Governor of Telangana, for very kindly gracing this occasion as our esteemed chief guest and delivering an inspiring message about the importance of an early detection of breast cancer. No words to thank Ms. Sujata Rao for delivering an excellent oration focusing upon advocacy, screening, and early detection and strategies for the future. Dr. Bhaskar Rao has stood rock solid behind Raghu's vision and dreams from day one. It is solely because of his unwavering support the breast cancer center concept was born in India, which has paved the way towards standardizing and improving breast health care in the country. Yash is Raghu's brother. He has stood shoulder to shoulder with Raghu in championing the various innovative and landmark initiatives of the Foundation to create the much needed awareness about early detection of breast cancer. Finally, I have a message to those watching the program. Festival time is here. Deepavali, Dasara are around the corner. Instead of buying a sari for your loved ones, I urge the men in this audience to gift a screening mammogram to your loved ones, which will undoubtedly save many lives. Jai Hind.
So we now conclude the program with the national anthem. Naveen, national anthem, please.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उज्जल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you very much.
Thank you very much. Thank you.